Welcome to Moments with Marianne. This is your host, Marianne Pastana. And we're here today with special guest, Dr. Jeffrey Egler, Chief Medical Officer at NOOM, who's here to share with us his white paper on food as medicine. So could the key to feeling better, living healthier, and having more energy be as simple as changing what's on your plate? Well, today's guest is here to share with us just that. Dr. Jeffrey Egler is a double board-certified physician in family medicine and lifestyle medicine. So welcome to the show, Dr. Jeffrey Egler.
Hi, Marianne. Thank you very much for having me. I'm excited to be here and have this conversation with you.
My goodness, what an honor it is to have you here and to talk about this. And I understand that you co-authored a white paper that looks at the role of nutrition and how that plays a big role in our energy, productivity, sickness, and disease. So what are some of the biggest takeaways you discovered in your research?
Sure. Well, we did author this paper that really helps to collate and to summarize a lot of the research that has been out there for the past couple of decades. And some of the biggest takeaways, there's I would say three big highlights and a big takeaway from this review of all this data and this summary. And the first one is food as medicine works. And just a quick overview of what that is. Food as medicine is really this idea, what we're trying to create as a movement where healthcare really focuses on prescribing food with the same rigor as or more as it would with drugs. So sort of a food care first approach. And getting back to the highlights, number one, food as medicine works. There is quite a bit of evidence that there are patterns such as a Mediterranean diet, such as a DASH diet, that deliver clinical gains. There are obvious clinical benefits from employing this strategy. Two, there is a business case for this. Nutrition improves productivity, and this can help bend the claims trend. So that being healthcare claims, insurance claims, reducing the cost of healthcare. And three, environment plus access really do matter. So introducing into the environment produce prescriptions, medically tailored meals or MTMs for people that are at high risk and particularly high cost, having healthier defaults at work, embedding registered dietitians and health coaches as support. These really drive uptake and prove that your environment matters. Now, looking at all of this, really the biggest takeaway here in summary is that food is really a performance lever. Workers that have unhealthy eating habits lose more on the job capacity, and nutrition programs that improve real access and the work food environment, they really move the needle in terms of presenteeism, not just metrics like cholesterol and other health metrics.
Well, hearing that food is medicine and taking a very serious approach to this, I think is so encouraging because I know we've heard little rumors about this. I mean, you talked about several diets. There's the Blue Zone diet as well that talks about how it really impacts people and improves their health if they follow certain principles. What are some of the principles that you discovered?
So that's a great question. So Blue Zone's diet is another great example. Um, I think one of the biggest principles that we discovered in doing this research, and first and foremost, I'll say, food as medicine is not really news. We have known this. I've been in medicine for 20 years, and it's at least the last 10 years of that being in management and at executive level in medicine. we have been working on implementing food as medicine programs for at least that long. And we have had evidence of benefit for at least that long. Our emphasis in repackaging this into a white paper now is that it just really hasn't been adopted to the level that we would really like to see, and the level that we know would be extremely beneficial to not only patients, but to the healthcare system, to employers that are responsible for costs. So we're really trying to re-emphasize this, repackage it, and how do we better sell this idea that we know that works, but really just isn't being adopted? Uh, we know that for the most part, people know what is healthy and what is not healthy. There are, of course, numerous controversies in nutrition, despite being one of the best studied things on the planet. There are still a lot of unresolved matters. That being said, I think we still know, for example, that whole foods are much better than fast foods. We know that ultra processed foods are problematic. We know that vegetables and whole organic foods are incredibly beneficial. We know that we should be reducing sugar, for example. And so, despite the fact that we know a lot of these things, and I think most people in the general population are to some degree aware of this, even intuitively, there is a problem, there is a disconnect, I should say, between knowing and doing. And that's where a lot of these programs can be really helpful. I'm the chief medical officer of NOOM, and what we do at NOOM is work with people to help them change their lives through better understanding the psychology, not just having the information and the education. That just doesn't work. It doesn't move the needle. People need support in terms of understanding why they're not changing their lives. What are the obstacles that they have to overcome? And so being able to embed practices, resources, support, education at the time of need into people's lives and their environment is really what we're trying to do so that we can really make a more appreciable change in people's attitudes and in their lives and in their ability to take information to action.
I know Noom is really big on making lasting changes by also changing mindset with food.
That's right.
And I think it's so fascinating how you have been able to drill down to that, to where you're looking at how people view food and make those adjustments over time.
Well, thank you. It's really been. I'm very proud of the work that NOOM has done over the past decade, even before my arrival, and it's really exciting to be at the precipice of where we are now. NOOM has really helped people for the past decade with probably the biggest problem in our society, both medically and culturally, which is being overweight or obese, which is associated with much of the chronic disease that we see in our country that has been really, quite frankly, getting worse rather than getting better. And this has been a problem that has been really difficult to deal with, despite the recognition in the general population and in the healthcare system and the healthcare system's efforts to attack this. There really hasn't been significant improvement, and in fact, things have been getting worse. But Noom has been one of those products and programs, and that's why I'm with them now, that has really been successful in reversing this trend and really helping people make change. And I'm really excited, as I was saying, to be on the precipice of this. We are now really opening our lens to, we have been helping people in their health and wellness by attacking this particular problem, but we're really widening the lens in terms of, we want to help people with their longevity in general, their well-being in general. How do we really take this mindset first and philosophy first, the psychology of change, and really help people be well, even in domains beyond metabolic health?
I know everyone is looking at AI to increase productivity, and I was wondering if you could tell us how nutrition and healthier food is frequently overlooked as a way to increase energy at work. What did your white paper find in the relationship with improved nutrition and work?
So, one important and interesting statistic is that poor on the job eating is associated with a 93% higher risk of major productivity loss. And these facts are really paramount to how we're really sort of trying to repackage and rebrand and recommunicate this food as medicine information, because it's not just affecting health. It's not just sort of a side dish that we should be serving up to help people be more healthy. It affects productivity as well, and that's why corporations uh, and our employers, who are often responsible for most, if not all, of our healthcare costs, should be really interested in this. So long running cafeteria nudges, vending machine overhauls where you're changing the quality of the food inside, on site markets, all of these things help to improve changes in the environment, help people. The average American eats, well, I shouldn't say the average American. What I will say is that a third of Americans, actually more than that, 36% of Americans have at least one fast food meal daily. So these environmental changes or implementations can really help improve these choices at scale. And so that's one of the big findings that we've seen. People that rarely eat fruits, vegetables, or low-fat foods have significantly higher productivity loss.
Ooh, that's good to know. And having that science show that to people, I think really helps.
Oh, absolutely. And there's so many other factors that have been studied and have demonstrated benefits. Absenteeism decreases when you have a healthier nutrition plan because you're recovering more, you're getting sick less, so you're coming back to work, you have less absenteeism. And then presenteeism, which is actually a term that I had to learn in doing this research, which is an even more prevalent problem than absenteeism, which is people are showing up for work, but their productivity is significantly impaired because they're just generally not well. So they're sort of showing up in an impaired state of well being. And this is pretty prevalent. Like I said, I mean, 93% productivity loss. That is, it's staggering.
So, what did your research uncover about how food and better nutrition can improve and prevent chronic health conditions and disease?
So there's multiple factors that are significant there. If you look, for example, at the level of nutritional deficiencies in the American population due to our standard American diet, that is staggering as well. The vast majority of us have significant vitamin and mineral deficiencies. Just to give you some off the cuff statistics, for an example, um, the micronutrients vitamin D and vitamin E, for example, which are very important for numerous health aspects, numerous biochemistry processes in your body. The percent of the population that is below the estimated average requirements, or what we call the EARs, is very high. 94 to 95% of persons. That's for vitamin D. For vitamin E, 88 to 90%. Looking at minerals, magnesium, for example, important for so many functions in terms of being calm, being de-stressed, sleeping well, also high, 52 to 56% below the estimated average requirements. And I'll also point out that when we're talking about this is such an important nutritional fact to be aware of. When you're looking at labels, when you're taking in this data, these estimated average requirements, the adequate intake, the AIs, these are just the numbers to prevent disease. These are not indicators of optimal levels, which is another thing that we need to be thinking about in our society too, is that the bar is so low in terms of how we think. We think about just getting enough, and we're not even, as I've already presented some data for, we're not even meeting that. but we're certainly not doing above and beyond that to get to the levels that we need for actual optimal health. Now, to just put this all into context, why do you need these vitamins and minerals? They're not just accessory and pluses. They're not just additives for us. You spend the first year of medical school studying biochemistry because it is foundational to health and well-being. Every chemical reaction that happens in your body that is responsible for all of the processes, whether it's your heart beating or your brain thinking, they all have biochemistry, chemical reactions at their foundation. And each and every single one of these hundreds of thousands of reactions has a vitamin, a mineral, or multiple cofactors involved in successfully achieving that process. If you don't have them, that process doesn't go forward. So your heart doesn't beat as effectively, your brain doesn't think as effectively. And when you have low levels of nutrients, that is the rate limiting factor. So all of the processes in your body, all of the energy production will be limited to the extent that your nutrition is limited.
Ooh, that's something to pay attention to. So if we're feeling a little off, there's more than one thing that could be happening.
That's absolutely right, and I think, it's one of the most underestimated things. So many people come to me as a physician, and they, just as you said, I feel off. I just don't feel well, especially in their 30s and 40s and beyond. More and more so, even sooner, I hear these complaints. I see these complaints, people in their 20s and even younger. And nutrition, I think we really know can be a big factor in this. In fact, it should be one of the first one or two factors, that and movement, exercise. Um, but it's often just sort of skipped over. We have culturally become sort of ingrained to want a more simple fix than an overhaul to our nutrition or our lifestyle for that matter.
So, doctor, I know there are many companies that offer wellness programs and health plans that help with obesity and diabetes and heart disease, yet these rates keep climbing and increasing. So, what are we missing here?
That's a great point because wellness programs, for example, gym memberships, initiatives where people are doing step challenges, getting particular benefits when you check certain boxes at work with regard to your health plan or your employee benefits. Um, we've seen these going into effect in the past 10 to 20 years as well. And to some degree, they can be helpful. But unfortunately, traditional wellness programs from the data in randomized controlled trials don't seem to change claims, again, health insurance claims, healthcare cost claims, or productivity levels in significant ways. What does work and what has been shown to be effective in these same trials is changing defaults in coverage. So, what are the defaults in our healthcare coverage, for example? So, are there healthier cafeterias? Are there covered food benefits, produce prescriptions, as I've mentioned, medically tailored meals for specific populations? Are there embedded registered dietitian or health coaching? These things have been measured against healthcare utilization and presenteeism and have favorable outcomes.
I was floored to hear that your white paper also explores how medical students are not being taught or provided really nutritional training. Can you share on that for us?
Yes, I mean this is something that this again is unfortunately, at least in the medical community and amongst doctors, this is not news. I think most doctors will tell you that their nutrition education. I've already mentioned that biochemistry you spend a whole year studying. In the second year of medical school, as a follow up to that biochemistry, you spend a full year studying pharmacology, the study of using drugs and medications to affect that biochemistry in the body. Um, Compare that to the typically less than 20 hours that is provided for nutrition education in medical schools. Uh, and despite the fact that this statistic has been well known, documented, and communicated uh, in our culture and in the medical system, there really hasn't been much of a change in that. So much so that only 14% of physicians feel comfortable giving advice. Uh, Obviously, this is kind of staggering information. Uh, but it's really important for us in terms of reevaluating how we're educating our physicians, and how we're going to be if we can't even educate our physicians about nutritional advice, where are people going to be getting this information? 86% of American physicians believe that they're not qualified to give nutritional advice, and yet really nothing has changed along those ways. So again, with this food as medicine initiative, we're really trying to reemphasize this movement and get these messages out there again in a way that is more energetic and really hopefully to affect change.
Do you think that this disconnect between the physicians being educated in regards to nutrition is why there's a little bit of a disconnect with consumers looking at nutrition in a more holistic way?
I do. I might be overgeneralizing, and hopefully the level of education of physicians with regard to nutrition has improved to some degree, but I think that if it has been mostly because of physicians taking it upon themselves to educate themselves. Part of this problem is because, as I've mentioned, nutrition being probably one of the best studied things on the planet, there hasn't there's not a lot of consensus yet. There's not a lot of evidence to prove uh, that one true diet is better than others. And quite frankly, I don't believe that there is one true diet, which is what makes it complicated because everybody has their unique needs. When nutrition education is sparse for physicians, this makes it very difficult. And the food controversies out there make it very difficult for physicians to really educate patients. And Another another confounding factor there is capitalism in general. I mean, people have their own agendas when they are speaking about certain ways of eating or certain products. So it's really difficult to know what is the truth.
Oh, you touched on a big one right there. I mean, we hear sometimes like, how they say like coffee's good for you and then the next
Right.
week coffee's bad for you and so people are I think a lot of times are left to try to figure out, okay, so which one is it?
That's right. And I think the key word in that example, coffee is good for you or coffee is bad for you, it's the you. Um, you plural or you as a generalization isn't helpful in terms of determining whether it's good for you as an individual. That is a very specific and complicated discussion that really needs to be happening with, I like to say you and a trusted medical health or wellness provider, but quite frankly, it is difficult to find those ones that are that are very versed in this and skilled. So it's helpful when your providers work with dietitians, nutritionists, but quite frankly, just as a lot of conventional medicine physicians are not well versed or as versed as we would like to be in evolving nutritional science, sometimes conventionally trained registered dietitians aren't as well. So, for example, some people are still talking about the old food pyramid. Hopefully, not many, but that is a very much outdated concept that we know for many reasons. Uh, some examples of really focusing on eliminating fats. We know that healthy fats can be very good for you. They can be very good for your energy. They can be very good for your brain. Focusing on uh, plenty of whole grains, for example, that's also a very controversial issue. So we need to make sure that we are working with finding and identifying providers and information that are more consistent with newer and better science.
Is this part of the reason why NOOM is so successful in the work that it does is because it's really addressing each person and their mindset?
Absolutely. One of our biggest focuses is really engaging frequently and getting a lot of feedback from our members. Um, the data that we receive helps us to personalize their path, their journey, and the information that we're feeding to them. So, as we're continuously doing our science research and evolving our recommendations and our programs, we're also tailoring them and curating them to the people's needs and the specific information that we see coming in from them. And so that's, again, one of the reasons that I'm excited to be working with NOOM, because digital platforms, I believe, are absolutely the way of the future of health and wellness. Nobody engages with their doctor a fraction of the time that they engage with their digital devices. And so being able to reach people on a daily basis, to be providing constant feedback, constant information, and support is riveting in terms of the difference that it can make.
I was really surprised that your research found that 70% of US food, the food supply, is ultra processed. Oh my goodness. Can you tell us why this is so bad and what we can do about it?
Sure. If we had to pick one problem to focus on, what is one thing that you can look at and try to change to make your diet healthier? Um, Rather than focusing on so many things that are in the media, sort of some of these trends that are more controversial, ultra processed foods, focusing on that is really a big win. So that is a staggering statistic. 70% of US food supply is ultra processed. But if you walk into a grocery store and look around and reorient yourself to that fact, it's really not hard to believe. Um, Anything that's in a box or a bag, I had a very astute patient tell me once when I described, do you think you have a healthy diet? And he said, well, I try as much as I can to not eat out of a box or a bag. And think about that. I think a lot of people are cringing hearing that. Like, how do you do that? Because most of the food that we eat as a society is out of a box or a bag. And if it's coming in that sort of processed packaged fashion, it's probably a processed packaged food. Now, the problem with ultra processed foods is that it's not really food at all. The difference between that and whole foods, plants, vegetables, even organic, lean, healthy meats. Um, that's real food. Ultra processed food is just exactly that. It's not only processed, it's refined, but it is done so to the max, usually to improve shelf life, transport times, um, comfort, cost. It's enhanced for flavor to make it more appealing. Uh, Not only does this have significant decreased nutritional value, if any at all, quite frankly? But there's also what we call anti-nutrients. So foods, calories that are actually taking the place of nutrients that are not only taking the place of some good nutrients that you could get, but also actually bad for you, harmful for you, damaging to your gut, decreasing the absorption of other nutrients. And so we call those actually anti nutrients. And in one particular NIH study, a randomized controlled study, people ate an additional 500 extra calories per day and gained significant weight on an ultra processed food diet despite matched macros in another diet. So, meaning that people were eating healthier diets, less ultra processed foods, but the same amount of macros, the same amount of calories, the same amount of proteins, fats, and carbohydrates. But because it wasn't ultra processed food, they consumed a 500 calories less and had no significant weight loss associated with that.
Oh, wow. That's big.
Yes, it's massive.
Wow, wow, wow. Well, Dr. Egler, thank you so much for taking the time to be on the show with us here today.
Well, thank you for taking the time yourself to address this super important issue. And again, hopefully we can, with partners and uh, partnering with persons like yourself, get this super important message out, not only to people in general, but to those organizations and employers that can really help to influence this by engaging uh, in trying to make some of these changes. And again, emphasizing that there is the benefit not only of improving health and wellness, not only decreasing healthcare costs and getting better value return, but also from the productivity standpoint. Better productivity, less absenteeism, less presenteeism, better recruitment of employees, because we know that uh, in every generation, but particularly the younger generations, they are really looking at health and benefits, sometimes over salary. Retention of good employees is so tied to employee benefits, such as wellness benefits now. And so we're hoping that this conversation can really help to affect change and make us all better.
Well, thank you, Dr. Egler. It's been such an honor to spend this time with you and to talk about your white paper on food as medicine. Make sure to download the white paper at noom.com/health. Well, we're at the end of our time today. I'd like to thank everyone for tuning in. You've been listening to Moments with Mary Ann, where we make every moment count.
In a single moment, your life can change. Moments with Mary Ann is a transformative hour that covers an endless array of topics with the best of the best. Her guests are leaders in their fields, ranging from inspirational authors, top industry leaders, and business and spiritual entrepreneurs. Each guest is gifted and a true visionary, a recognized leader in her own work, and while teaching others to develop, refocus, and grow, Mary Ann will bring the best guest and sometimes a special surprise. Don't miss this. You never know just which moment will change your life forever. Make sure to tune in and visit momentswithmaryann.com for more information.